Hello and welcome to another intensivecarehotline.com and intensivecareathome.com live stream. Thank you so much for joining, and also thank you for those of you watching on replay. I'm doing another live stream, Ask Me Anything, so you can ask me anything as it relates to your loved one being in intensive care or intensive care at home. Before we go into today's questions, feel free to type your questions into the chat pad or join me live on the screen on the stream. And you can join me live on the stream by using the link that I'm pasting here, the StreamYard link, so you can join me here if you like. Before I go into today's topics, what makes me qualified to talk about critical illness in intensive care and answering questions for families in intensive care. Once again, my name is Patrik Hutzel. I'm a critical care nurse by background. I have been working in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years. And I have been consulting and advocating for families in intensive care for over 10 years, since 2013, here at intensivecarehotline.com. And it is without any exaggeration when I'm saying that we have saved many lives with our consulting and advocacy. Obviously, there's a team working with me, and big shout out and big thank you to my team here that helps me to help families in intensive care. And if you look on our testimonial section at intensivecarehotline.com, or if you look at our testimonial section at intensivecarehome.com, you will see that what our clients say. We also have done some client interviews that you can find at intensivecarehotline.com on our podcast section, again verifying the work that we've done and that we have saved many lives with our consulting and advocacy. I am also the founder and managing director of Intensive Care at Home. You can find more information at intensivecareathome.com. With Intensive Care at Home, we are sending critical care nurses into the home for predominantly long-term ventilated adults and children with tracheostomies, but also for BiPAP, CPAP ventilation without tracheostomy, but also tracheostomy care at home when adults and children are not ventilated. We're also providing home TPN, home IV potassium, home IV magnesium. We're providing port management, central line management, PICC line management, and Hickman's line management. We are also providing palliative care at home. With Intensive Care at Home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. If you need help with Intensive Care at Home in the US or in the UK, please also reach out to us. We can help you there privately. We also provide level 2 and level 3 NDIS support coordination with Intensive Care at Home. Without further ado, let's dive into today's questions. And let me just get to my emails so that I can start reading out the questions, or some of the questions that have come in during the week, or even, we're barely keeping up with answering all the questions that we're getting every single week. And once again, if you have any questions, either type them into the chat pad or join me live on the show here. You can talk to me directly by using the StreamYard link. You don't necessarily have to go on camera. It's up to you. You can talk to me without going on camera. So, first question from Estelle. Estelle says, "Hi, Patrick. My brother is in critical care after being stabbed in the chest. He's on a ventilator and sedated. At times, he violently shakes his head and arms around. They restrain him. Why does he do that? Please help." Right. Okay. So, Estelle, the challenge with someone that's being admitted to critical care after an accident, or after, in this situation, after a stab wound, I've seen it many times. I mean, I looked after thousands of critically ill patients in intensive care when I worked in intensive care at the bedside. Your brother would have been put into an induced coma. He would be sedated with propofol, with midazolam, Versed, potentially with Precedex. He would be on morphine or fentanyl to enable the intensive care team to ventilate him, right? And he would most likely also have a chest drain with a stab wound. He might have had surgery, right? It's not quite clear whether he had surgery or not. But one way or another, he's in an induced coma. If he had surgery, that would further deepen his induced coma, and it would potentially further delay or make it more difficult for your brother to wake up. So here's what often happens when you wake up a patient from an induced coma after or during critical illness. You wake them up, they have a breathing tube in their mouth, and they often have no recollection of what's happened whatsoever. They wake up with the tube in their mouth, foreign environment, strange environment, foreign people talking to them. Family might not necessarily be around straight away. The biggest stumbling block here is often they can't talk. And their brain might also be very foggy from the induced coma, so they might not even comprehend of what's happening, even though someone is trying to talk them through what's happening calmly, right? They may not realize what is happening, right? And then if they do restrain him, once again, that would be very irritating for your brother. And if you don't restrain your brother, maybe he's pulling out his tube prematurely, right? You don't want your brother to take the tube out prematurely either, right? So when you wean someone off the ventilator and the breathing tube with the goal to extubate them, you don't want to do it prematurely. You want to do it at the right time, right? So that your brother can stay off the ventilator. Because once you take out the breathing tube, you want your brother to stay off the ventilator predictably. Very important. You don't want to take the breathing tube out and then your brother needs to go back on the ventilator. You can do more damage there than good. And that's not what you want. Okay, so what's the way forward here? The way forward here is that they need to gently wake him up. They need to keep trying over and over again. Very important that they do keep trying over and over again, right? You can't just give up at the first sign of him not waking up properly. It's very important that they keep trying. It's also very important that they might need to change sedation, right? It could also be that he's potentially withdrawing from some of the sedatives and the opiates, like the fentanyl, morphine, midazolam. They are highly addictive in nature. So sometimes they might get your brother addicted to it, and then he's struggling. When you switch those sedatives off or opiates off, he might be struggling just by withdrawing from the medications, right? So then you have to change sedation. You might have to get in with a little bit of clonidine or Precedex. So there are ways to manage that. And, the other thing that if for whatever reason he's not waking up, the other thing you need to look for is he potentially having brain damage? Has a neurological event happened in the meantime, right? God forbid, did he have a stroke or any seizure? So one way to rule that out is to do a CT scan of the brain or an MRI scan of the brain, or to do an EEG. So it's really important to do that. So I hope that answers your questions. Your question there, Estelle, and let me know if you need anything else. Now, Triple Gemini, welcome back. You're saying, hi, I spoke with you last time. My loved one has a tracheostomy and a PEG, and has woken up. Great. So help me, because I know you were here last time, and I don't quite recall our conversation, but so he's got a tracheostomy now, he's got a PEG tube now, and he has woken up. Unfortunately, his mom is sending him to a long-term facility. Triple Gemini, what I can say to that is do not let your loved one go to an LTAC no matter what. So many inquiries we've had over the years. I spoke to a client a couple of weeks ago, and his brother went into ELTAC and he died there because they couldn't manage a medical emergency, right? And this is not the first time we're seeing it. It won't be the last time. I argue letting your loved one go to ELTAC is almost like a death sentence. I hate to say it. I hate to break the news, but I stand by what I'm saying because of all the work that we've done over the years, talking to ELTACs and getting the incompetence firsthand from them, talking to enough families that are literally begging us to get their loved ones out of ELTAC, which is something we are doing successfully as well. We've just helped 2 clients in the last couple of weeks with our advocacy to get them from ELTAC back to ICU with really good results. So no matter what you do, triple Gemini, if your loved one goes to ELTAC, it is doomed to fail. And that's all I want to say to you here, that it is very, very dangerous for your loved one to go to ELTAC. And from my experience, every time we are making an argument for people not to go to ELTAC, we're right on the money, because every time we're putting forward the clinical reasons why they can't go to ELTAC, it's never really been denied, because we are the clinical experts and we can advocate for our clients with our clinical reasoning as being intensive care nursing experts, right? So I know that's probably not what you want to hear. It's good that your loved one has woken up, but do not let him go to ELTAC. I don't know how you're going to talk to his mom about it, but it's going to be really, really difficult if he goes to ELTAC. So if you have any other questions, please type them into the chat pad or use the StreamYard link that I posted there, and you can join me here live on the call and join me live on the call here, and you can ask your questions to me here. Okay, next question comes from Tiffany. Tiffany says, "Hi Patrik, my dad is in ICU for more than a month now. He has ESRD, in tracheostomy, trying to wean off the ventilator, recurring pneumonia and infections. He's on multiple antibiotics. He had a stroke and mild hemorrhage, cardiac arrhythmia and multiple blood and platelet transfusions. For his diagnosis, the doctor have given him acute respiratory failure type 1 and 4, secondary to septic shock. Secondary to septic shock, acute respiratory distress syndrome, also known as ARDS, secondary to COVID-19, confirmed pneumonia, critical pigtail insertion, tracheostomy, sepsis secondary to fungal pneumonia, Candida albicans, and on top of a VAP infection, bacteremia, Pseudomonas infection, infected wound, Klebsiella pneumonia, and catheter-associated urinary infection, albicans. Next, he's got focal seizures. They have ruled out intraparenchymal hemorrhage. He's got a septic ileus, thrombocytopenia secondary to infection on top of platelet refractoriness. He's got anemia, multifactorial causes, malnutrition, ESRD, chronic disease. He's got end-stage renal disease secondary to nephropathy. He's also got hypertensive cardiovascular disease, coronary artery disease, dilated cardiomyopathy, sinus rhythm arrhythmia. He had a cardiac arrest on December 27th and 28th, 2023. He's got acute liver injury, probably secondary to ischemic hepatopathy. He's got pulmonary tuberculosis, clinically diagnosed, intensive phase of treatment. How can my dad be stable again and be able to go back to the way he was? I have a copy of the PDF and of the full clinical summary. I would like to send it so that you could understand the situation better, from Tiffany. Okay. Tiffany, I'm incredibly sorry to hear about your dad's situation. He's got a long list of things not working for him. And that is extremely, extremely concerning. It sounds to me like he may not survive that. It sounds really, really complicated and really, really difficult to be treating him here, right, with all these issues going on. And this is an email from February. That's how long the backlog is for emails that are coming in that we get to on these YouTube lives. If you need help, don't wait for your email to be answered. Send them anyway, but I don't get to them on time because we're busy answering our phone calls and answering the questions here on YouTube Live or answering the questions via email. So, the quickest way you get help from us is if you go to intensivecarehotline.com, and if you call us on one of the numbers on the top of our website. That's the quickest way we can help you. Okay, so given that your dad has been in ICU for over a month, and given this long-standing or long list of medical issues, I would imagine that your dad is on inotropes or vasopressors to keep a blood pressure in line with life, because I don't think that your father with these complications would be off inotropes. He would be on dialysis. He's most likely on cardiac medications with ARDS. The question is, have they cured the ARDS? Because if they haven't cured, or if they can't cure the ARDS, I do believe, especially with his cardiac issues and kidney issues as well, that survival chances for your dad are reasonably low in this situation, right? It also looks like to me he's got liver failure and an ileus. An ileus is a bowel obstruction, a mechanical or a paralytic bowel obstruction. But these are all things that unfortunately, don't work in your dad's favor. So I would hope that no matter what, that the intensive care team here is treating him with the best of their abilities, with antibiotics for the infections, with dialysis for kidney injury, that they do ventilate him with the right ventilator settings for ARDS, that they give him, maybe nitric oxide, that they give him a proportional nebulizer, that they potentially give him Viagra for the ARDS or for pulmonary hypertension. Maybe he was even in prone position. Maybe he can go on ECMO. That could be another option for him. To let the ARDS heal, if possible, let the ARDS cure. I've seen many patients on ECMO being treated for ARDS and successfully treated for ARDS. So I'm not sure whether the intensive care team has given you all options available here in terms of treatment for your dad. You should make those inquiries and you should ask those questions. Also, how are they treating the sepsis? Have they isolated the right bacteria and have they isolated the right antibiotic to treat him with that? Also, if he's got seizures, he must be on anti-seizure medication. And if he's had an intraparenchymal hemorrhage, that could also contribute to his brain potentially being foggy, because that's leading to a brain injury as well. You haven't shared whether your dad had brain surgery as well, right? Obviously he's got end-stage renal disease. He's got hypertensive cardiovascular disease, coronary artery disease, dilated cardiomyopathy. The list of issues, unfortunately, is very long. And like I said, they need to treat him to the best of their abilities. I mean, you haven't mentioned that they've given up. But what you haven't mentioned either is he getting specialist input? For example, for the end-stage renal disease, is there a renal specialist involved? With anemia, is there a hematologist involved? With the ARDS, is there a respiratory specialist involved? With the cardiomyopathy and the cardiac failure, is there a cardiologist involved? What are they saying? Also, what does your dad want in a situation like that? Have you considered that? Does he want everything to be done, right? Or does he potentially not want to prolong his suffering in a situation like that? Right? You also haven't shared your dad's age, so it's difficult, to say how old is your dad, but what does he want in a situation like that? Has anyone considered maybe earlier or now a kidney transplant? Has anyone considered potentially a lung transplant or a heart transplant? Is he young enough to meet that criteria? Right? So I can't really tell you what to do next at this stage, besides making sure they're doing everything they can and making sure you get specialist input, right? That would be really, really important. So I hope that answers your question, Tiffany. Now, if you have any question while you're watching this, please type your question into the chat pad or join me on the live stream here on the YouTube Live. Now, let's go to the next question from just give me one moment. I just need to. There it is. From Lynn. Lynn says, "Hi, Patrick. My sister had a fall during the holidays. She fell down some stairs. We all thought she may have tripped up, to find out she had an aneurysm which burst. She sustained 2 fractures on the brain. They said she has a very serious head injury. She was hospitalized in Spain and put into an induced coma for 3 weeks, then was flown home to Edinburgh to the Royal Infirmary. They took her out of the induced coma after a week, but she still needs the ventilator to help her breathe. There's no response at all from her. They're saying they're not happy with her progress, and she's been lying flat since it happened. So they said going to try sitting her up, see if it helps at one point. The kid said, 'Mom, if you know we are here, move your finger.' Head, stick tongue out, which she did on a couple of occasions. She has opened her eyes, but nothing really more than that. We all know she's seriously ill, but really need to know chances her recovering as we think they're giving up on her too soon. Thank you. I hope we can find some comfort in your reply." From Lynn. Okay, Lynn, that sounds, on the one hand, it sounds like a really difficult situation, but on the other hand, it is important that you look at the positives here. Okay, your sister is still here after about 3 weeks of the aneurysm burst. That's the good news. The other good news is she is obeying simple commands. That's good news, right? Also, you're saying in your email she has a very serious head injury. Well, can you qualify that? What I mean by that is, can you talk about, did you have an MRI scan of the brain? Did you have a CT scan of the brain? She must have had some brain surgery with the aneurysm, with the burst aneurysm. And what's the neurosurgeon saying? What is the neurologist saying? Right? Also, they took her out of the induced coma after a week, but she still needs the ventilator to help her breathe. The next question is, does she have a ventilator with a breathing tube in her mouth? Or a ventilator with a tracheostomy, right? So, because if she has, for example, a tracheostomy, she can be sitting up and she can be mobilized, and that will help her waking up. If she has a breathing tube, it'll be more difficult to wake her up, to sit her up, to mobilize her. So just because they're not happy with her progress doesn't mean they shouldn't keep progressing things forward, and mobilizing her and doing a tracheostomy after 3 weeks would be reasonable. So keep focusing on the positives. And how long is a piece of string? Well, you don't know how long it'll take for her to wake up, but mobilizing her will help her to wake up, right? That's assuming she has no other fractures, she's not waiting for surgery. So that will help her, right? And be patient. And I know that's easier said than done. For some patients, it takes weeks. For some patients, it takes months to improve. But given that she's obeying simple commands, that is a really good sign for you and for your family. And you should be going with that. No need to give up here, right? So, but talk to the neurologist and talk to the neurosurgeon, what they think, and get her to mobilize. And if she doesn't have a tracheostomy yet, get her to have a tracheostomy if she still needs the ventilator. That will help with mobilization, will help with stimulation, they can also stop any sedation she's on if she has a tracheostomy. They might need some sedation when she's still on a breathing tube. So keep that in mind, please, Lynn. I hope that answers your question, Lynn. Okay, Gamma Level Up says, my mom is in ICU for 4 weeks and she's just not now waking up. She has a tracheostomy now day 14. Now she's opening eyes but not moving her arms and legs. Gamma Level Up, thank you for your question here. Why is your mom in ICU? Why is your mom in ICU? And also with the tracheostomy she had, did she have a PEG tube as well? So if you can answer me those 2 questions, then I can guide you in the right direction. So let me know why your mom is in ICU and does she have a PEG tube as well? Right? While I'm waiting for Gamma's response here, let's get on to the next question. Oh, she had a heart attack. Okay. She had a heart attack. Okay. Did she have a heart attack with a cardiac arrest? And she has a PEG tube. Okay. So did she have a cardiac arrest while she had the heart attack? That's one question. The other question is did she sustain a brain injury? Right? Because if she had a heart attack, she should not have sustained a brain injury. If she had a cardiac arrest as part of the heart attack, she might have sustained a brain injury. Can you shed more light on whether she had a cardiac arrest as well? Or anything else for that matter that you haven't shared. Give me as many details as possible. And even better, if you want to join me live on the call here, that way we can hopefully get to the bottom of things much quicker. You know, if you want to join me live here, you can just use the StreamYard link here, because then we'll get to the bottom of things much quicker. Okay, so you are saying pneumonia was the cause of her heart to stop. So she had a cardiac arrest, okay? Okay, so she had a heart attack, then she had a pneumonia, and then she had a cardiac arrest. Gamma, there is a difference between a cardiac arrest and a heart attack. There is a difference. It's not the same. It might be helpful if you can just join me live on the call here, and then we can, you know, it's so much easier to talk to you rather than, you know, writing comments here. But, you know, we'll get there eventually. But I'm just giving you, trying to make it easy for you. So, if the pneumonia was the cause for her heart to stop, did she have a cardiac arrest, and how long did she have CPR for? Do they think she sustained a brain injury? And if so, did they do CT scan or an MRI scan of the brain? So you are saying she had 3 heart attacks in the same day. Okay, that's no good. How long was the cardiac arrest for? Once again, Gamma, there's a difference between a cardiac arrest and a heart attack. It's not the same. They're 2 different things. And did she sustain a brain injury? Do you know? Do you know? While I'm waiting for your answers, they say anoxic brain injury. Okay. So, have they started to mobilize her? Have they started to get her out of bed, Gamma? Right? And what are the next steps? What are they telling you are the next steps? Right? And my advice is here, if you are in the US, I don't know where you are. my advice is do not let her go to ELAC if you are in the US. Right? Does she have seizures? Does she have seizures? And what is the neurologist saying about her recovery? Can she recover? What are they saying? She's just having the trach and the peg. Okay, good. That doesn't, so she doesn't go to ELAC just yet. That's good. Assuming you are in the US. What else? She has seizures. She have seizures. They say recovery is poor. Right. Okay. Have they started to mobilize her gamma? Have they started to mobilize her? Have they started to get her out of bed? Because a recovery will definitely be poor if she's not getting mobilized. That much is for sure. Right? She will certainly not recover if she's not getting mobilized. Have they started to do that? That would be a really important thing to find out here, so that I can point you in the right direction with this. For any of our other viewers, type your questions into the chat pad too, or join me live on the stream here. No, they haven't. Okay, so they need to start doing that gamma. So let me illustrate this to you. So picture this. Someone tying you to a bed as a healthy person for a couple of weeks. What will that do to your brain? Right? You're not allowed to leave. Someone's tying you to your bed for 2 weeks. Well, that won't be good for your brain. Now, your mom has a brain injury, right? Imagine now she's critically ill. They're tying her down to a bed. That's terrible, right? So they need to start mobilizing her. That is a non-negotiable. That is assuming she's hemodynamically stable, her observations are stable. That's assuming she doesn't have any fractures, she's not waiting for surgery. You know, there's nothing really stopping her from being mobilized besides them potentially being complacent. Okay, so let's move on to the next question, unless you have any questions here and you type them into the chat pad or you join me live on the stream here. So next question is from Victoria, who says, hi Patrick, my brother is on a ventilator and was breathing on his own 5 hours and then became tachypnic. Should I consider putting him on a ventilator or CPAP support? He does have a tracheostomy. Thank you so much for all you do. Right, that is a great question, Victoria. So, if he became tachypnic after 5 hours on the ventilator, and that I assume you mean he's on a spontaneous breathing trial, he's breathing on the trach collar, and he's breathing on the tracheostomy mask, then absolutely he needs to go back on CPAP. And sometimes going from the trach collar back to the CPAP might not be good enough. Sometimes you might even have to go back to SIMV or a controlled rate or controlled mode, where the ventilator is doing most of the work. Right. And I know, Victoria, I know because you are one of our clients, and we know you and I have spoken on the phone many times, and via email. You know, I know your brother did go back on CPAP, and I know he's had more spontaneous breathing trials because we were just talking last week. So I know he's making progress. And I remember talking to Victoria. The other issue was with Victoria's brother as well. They didn't mobilize her brother, right? So once again, for anyone watching this who has a loved one critically ill in intensive care, the sooner they can mobilize your loved one, the better chances are they will recover, the better chances are they will get off the ventilator, the higher chances are there are less complications. Okay, really, really important that mobilization starts as early as possible. Let's move on to the next question, or type your questions into the chat pad here, or join me live on the StreamYard link, which I will post once again here. You can join me live on the show and you can ask questions here. Here's the StreamYard link again. You can join me. You don't need to go on camera. You can just, talk, or you can type your questions into the chat pad. If there are no questions, then I will move on to the next question, which comes from Holly. And Holly says, I have many concerns with my mother in ICU. She had a stroke, she is having cancer, and she's having hernia surgery all at the same time. Should I be concerned? Well, certainly, if your mom had a stroke and she's got cancer and now she's going for hernia surgery and she's in ICU, that is certainly concerning, right? And many factors need to be considered. Now, like I always say, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that is exactly what you are dealing with here, Holly, because you don't know what's next, and you don't know what you don't know at this particular point in time. If your mom needs hernia surgery and she's got cancer and she is having a stroke and she's in intensive care, there are numerous complications potentially waiting for her. I get that. So, and that's certainly concerning. So the first question here is, Holly, does your mom have an advanced care plan, right? Because if she has an advanced care plan who says, hey, I want X, Y, and Z to happen if I'm ever critically ill in intensive care, then, you have guiding posts on what to do. For example, if she's in intensive care with cancer and she gets chemotherapy, that potentially makes her immunocompromised. That makes her immune system very weak. If she's having surgery, there's a risk of infections happening afterwards, and then can she fight the infection, for example, if she's immunocompromised with the cancer, right? With the strokes, how severe are the strokes? Is she waking up? Can she wake up? What's her neurological condition? How far are you prepared to go? How far is your mom prepared to go during surgery, for example, or if treatment doesn't go as planned? There are many unknowns here where you haven't shared the full picture with me. And this is why I'm saying it is so critically important that when you reach out to us, that you have as much information as possible. Ideally, you have access to the medical records, because you have a right to access medical records. It's not a privilege, it's a right. Okay. So, Holly, most families in intensive care don't want to give up. And I'm not even suggesting you should give up, but you should be, looking at the bigger picture. You should be getting a second opinion here, which we can do here at intensivecarehotline.com. But we either need to talk to doctors and nurses directly, or we need to look at medical records. Would be critically important in your mom's situation to look at medical records, because you're giving us some insights, but not enough to guide you with it. And what does it mean if you're saying you're concerned about stroke, cancer, and serious hernia surgery? What else is happening? Is your mom in ICU already, or are you just concerned that if she has hernia surgery, that she's going into ICU? So I hope that helps and points you in the right direction of what to do next. Now, if you have questions, type them into the chat pad now, or join me on the show live and talk to me directly. I can answer your questions just by clicking on the StreamYard link. If you are not having any questions and you just want to listen to the questions that I'm reading out, that's fine too. I'll just read out the next question that's coming in from June. June says, hi Patrick, I'm very frustrated because we are getting conflicting information from hospital staff, doctors and nurses about my dad's condition. I can understand that this is extremely frustrating if you don't know where you stand with everything. Once again, it is critically important that you get a second opinion And it's critically important that you get an opinion from someone who doesn't have the hospital agenda on their radar. Like here at intensivecarehotline.com, we don't have the hospital's agenda on the radar. We have your agenda on the radar. You know, we want to help you and your family getting the best care and treatment. And don't get me wrong, there's a lot of good things happening in ICU. You know, 80%, 90% of what's happening in ICU is pretty good. But it's the 10% that's not good that we are dealing with here, you know. And I can only reiterate that from my decades-long experience in intensive care, the worst-case scenario for an intensive care unit is that they don't want to look after someone with an uncertain outcome indefinitely. And a lot of the clients that we are dealing with here, they're meeting exactly that criteria. They're presenting a situation for intensive care units where they are critically ill, it's very uncertain, and they could be there for long periods of time to come. And that is the worst case scenario for intensive care teams. And that is also often why you might be getting conflicting information from doctors and nurses. You also should not be too concerned about the negativity that they're probably throwing at you. You know, you should be looking at the positives, and you should be optimistic, because you're not doing yourself a favor if you stay negative. But it is critically important that you get a second opinion and that you reach out to us with more information at intensivecarehotline.com if you are finding a situation like this. Now, let's move on to the next question, which comes from Richard. Richard says, my biggest frustration is that there's minimal mobility progress in ELAC, and that there are tracheostomy issues. Right, so like I've been saying for the longest here, do not let your loved one go to ELAC, full stop. We've had the questions here from Triple Gemini, who's worried about her loved one going to ELAC. Well, all I can say is put a stop to it, right? Also, Gamma, with your questions, again, you haven't identified which country you're in, but if you are in the US, I do believe that your mum is at risk of going to ELAC, given that she has a tracheostomy and a ventilator. And if you're in the US, she's also at risk of going to ELAC. And I strictly advise against it. And if you need help how to keep your loved one in ICU instead of going to ELAC if you are in the US, we have some proven strategies around that. And we also have proven strategies to get patients back from ELAC to ICU. Once again, when we look at medical records, it's easy for us to extract the information, the relevant information, making sure your loved one gets best care and treatment. Critically important that your loved one gets best care and treatment. And sometimes patients don't get it, and it can only be achieved with our advocacy by giving you that critical second opinion and by putting pressure on intensive care teams or on the hospital. Unfortunately, that's often the only way. I wish it was any different, but I haven't found a different way besides the consulting and the advocacy to put pressure on the ICU. So I'm not surprised when Richard says that there's no mobility progress, because once again, LTACs, they really don't know what they're doing, and they often don't have the resources to mobilize patients. And this is the bait and switch that families in the United States often get in ICU. They get the trach and the PEG for their loved ones, and because they've been told, oh, once your loved one has a trach and the PEG, then we'll go to LTAC, and LTAC will wean your loved one off the ventilator. They will do all the mobilization. And it's bait and switch, no more than that, because then you go to LTAC and you will find that none of it is true. And you will find that your loved one gets none of it, which is exactly what's happening here in Richard's situation. And then what happens often, there's a 30-day window for LTAC patients. And if they're not improving in the 30 days within LTAC, then the LTACs often threaten the families or want to move patients on to SNF, to a skilled nursing facility. And that is even worse. That is even worse. So you have to be one step ahead. You know, you have to be one step ahead of the hospital, and you have to have your ducks in a row. And you can really only get your ducks in a row if you're working with someone like us here at intensivecarehotline.com, who knows the system so well, who can anticipate the next steps, so you can actually be one step ahead of the hospital even, you know. That is really important. Okay, let's move on to the next question. Once again, please type your questions into the chat pad here, or join me live on the show through the StreamYard link, and you can talk to me directly here. If not, I'll keep reading out the questions that have come in during the week, and I will answer the questions. The next question is from Terrell. Terrell says, "Hi Patrick, my dad had a cardiac arrest and no oxygen to the brain for 8 minutes. Once he got to ICU, his body was cooled for 48 hours and an MRI scan of the brain was done, and it has shown brain damage. He also developed seizures, which are not under control. He was taken off the ventilator and has an oxygen tube in his nose. He has not answered any commands or completely waken up. He also has a pneumonia. It's been 8 days now. Is there anything as a family we should be asking the doctors and neurology doctors about getting the seizures under control, or should we still give it time?" That's a great question, Terrell. It is interesting to hear that he's off the ventilator while the seizures are not under control. And it's also interesting to hear that he's off the ventilator while he's not answering commands or completely woken up. That might be the reason for his pneumonia. It might be. So let me explain to this. First off, the seizures should absolutely be under control. However, let's just say they were giving him anti-seizure medications such as Keppra, phenytoin, maybe Vimpat, maybe sodium valproate, and others, and benzodiazepines such as diazepam or midazolam. The problem then might be that he gets too drowsy, and that might get him back on the ventilator, right? If he's back on the ventilator, he won't be able to talk. It will keep him in ICU. The sooner he can go to neurology rehab, the better, right? But the seizures absolutely must be controlled, and I'll tell you why. If the seizures aren't controlled, it's sort of a vicious cycle, and he will develop even more brain damage if the seizures aren't controlled, right? Also, if he has pneumonia and he can't obey commands, there is another risk of him potentially needing to go back on the ventilator, right? How are they treating the pneumonia? Have they isolated the bug? Have they isolated the bacteria, the fungus, the virus, and treated accordingly, right? So that is the question here. Also, if he has pneumonia, he might benefit from some BiPAP or some CPAP, which is non-invasive ventilation with a mask, and he might benefit from that to open up the collapsed parts of his lungs. That would be a result of the pneumonia. But it is also very positive to hear that he's off the ventilator. That is very positive to hear, even though I find it hard to believe, But getting the seizures under control is inevitable for your dad's recovery. Absolutely inevitable, right? So it's not really negotiable, and the neurologist needs to take charge of that. So really good question there, Terrell. It's also, you're saying it's 8 days now. That's not a long time, not a long time. And your dad has made a lot of progress within those 8 days. There's no question about that, given that he's off the ventilator, but he needs to have those seizures under control, full stop. Okay, let's move on to the next question. Unless you have any questions here, please type your questions into the chat pad or join me live on the show. I've got another 10 minutes to go. And please type your questions into the chat pad or join me live on the link here. just click on the StreamYard link and then you can join me here and talk to me directly. In the meantime, I will read out another question from Jonathan, who says, it seems actually pretty common for the night terrors. Do you continue to have any of those dreams again? Do you have any that were the exact opposite of horrific? I still can remember what it feels like every dream in order, as I'm calling on memories, not dreams. I know 3 months was long enough to change who I am on every level of my being. Religion, philosophy, perspective, consciousness, I could go on. Do you ever have triggers or anxiety or depression related to specific dreams that feel as if pure human emotion, or not like a dream, but another time in which you lived and existed with another completely complex life and family? Sorry for all the crazy questions, just kind of running off my feet. So this is actually in response to a comment from another reader, and both of them were patients in intensive care, long-term patients, and they're talking about their experience. And it's always interesting to hear what people have to say. So this is a slightly different context where this reader talks about their experience as a long-term patient in ICU, and it sounds horrific, you know. So just because you survive ICU, you still might be left with some, you know, what I consider is post-traumatic stress, you know, nightmares, not feeling your best, you know. It's not a good situation for sure. But there are support groups out there, and I encourage you to check out intensivecaresupport.org for support for ex-ICU patients and survivors of ICU. Okay, now next question is from Carl. Carl says, hi Patrick, my mom is not waking up after cardiac surgery after many days. Okay, Carl, this happens often, right? And I've covered this many times, but I also know, just because I covered it in the past in short, quick YouTube videos or in other YouTube videos, you know, it keeps coming up over and over again. And of course, I will answer your question here. So, Carl, let's just take the ideal scenario after cardiac surgery. The ideal scenario after cardiac surgery is that patients go to cardiac surgery, often elective, which means it's planned. They have the cardiac surgery, whether it's bypass graft surgery, whether it's valve replacement or valve repair. They go into ICU, you know, after sometimes 3, 4, or 5 hours of surgery. You know, because it's heart surgery, patients need to be stabilized. They need to be monitored for at least 24 hours in ICU. But if all goes well, they will be extubated within less than 24 hours, and then they move on to a cardiac ward or a cardiac floor in the hospital, and they continue their recovery that way. Now, several things can go wrong when patients have cardiac surgery. Surgery might take too long, right? Because when cardiac surgery is happening, patients are on a bypass machine because the heart stops pumping during surgery. So the bypass machine takes over the function of the heart and the lung. So if there's prolonged surgery, that delays waking up. Okay. Other things that can happen after cardiac surgery is hemodynamic instability, right? Patients require inotropes, vasodilators, vasopressors, and so forth. That delays waking up. Patients have post-operative bleeding. They might need to return to surgery. That delays waking up. Patients might end up with a cardiac tamponade, right? And that requires, again, surgery, redo surgery. They have to open up the chest again, evacuate the tamponade. That will delay waking up. Patients post-operatively after open heart surgery have complications such as irregular heart rhythm, such as atrial fibrillation or heart blocks. You know, that sometimes can delay patients waking up. So the question for you, Carl, is what happened to your mom in terms of complications? Because I can almost guarantee you there have been some post-operative complications that you didn't see coming, and that's why she's not waking up. Because I would also imagine your mom and maybe yourself have been sort of walked through this experience saying, yep, you'll have open heart surgery the next day, you'll wake up in ICU, you will get extubated, and then you'll move on to a cardiac ward or cardiac floor and everything will be fine, right? And obviously that doesn't seem to be the case. Now, other things that can happen reasonably quickly after open heart surgeries, patients can develop sepsis or they can develop pneumonia, right? Because they're ventilated, and the risk to develop sepsis or pneumonia is higher. Also because the lungs are collapsed during cardiac surgery, that also increases the risk of a pneumonia. Other issues that can happen after open heart surgery are, cardiac function might be poor, right? Your loved one might end up on a balloon pump or intra-aortic balloon pump to support the heart, or even worse, sometimes they end up on ECMO. So, have you looked at everything that's happened so far? Or is it just simply that your mom isn't waking up and you don't know why? So I hope I've given you enough scenarios now why your mom may not wake up after open heart surgery, and you can dig a little bit deeper. And, if you're getting stuck, of course, just reach out to us here at intensivecarehotline.com. Now, I am going to wrap this up in a minute. I would really appreciate if you subscribe to my YouTube channel if you like the videos that I'm making. Click the like button for the video, click the notification bell, leave your comments below what you want to see next, what questions and insights you have, and share the video with your friends and families, of course. Like I said, I have been working in critical care for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and we've been consulting and advocating for families in intensive care at intensivecarehotline.com since 2013 for families all over the world. We have been saving lives, many lives, and you can verify that on our testimonial section or on our podcast section at intensivecarehotline.com, where we've done some client interviews as well. That's also why we created a membership for families of critically ill patients in intensive care that you can become a member of if you go to intensivecarehotline.com, if you click on the membership link, or if you're going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. You also have access to 21 exclusive videos and 21 exclusive ebooks as part of the membership that will help you to steer this incredibly difficult territory that is intensive care. I have written the ebooks personally and I've recorded the videos personally, and it will help you making informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment while they are in intensive care. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you, with you and your families. And I talk to doctors and nurses directly as well. And you will find that once I start talking to doctors and nurses directly, that the dynamics will change in your favor, because once I talk to them, they know you have someone on your team that understands intensive care inside out just as much as they do. And once again, it'll help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. I will also ask the questions to the doctors that you haven't even considered asking, but must be asked, and you will see as the conversation flows that I will get a lot more information out of them than you can by yourself. I also represent you in family meetings with intensive care teams. We also offer medical record reviews in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to to support at intensivecareathome. To support at intensivecarehotline.com. If you need intensive care at home, go to intensivecareathome.com. With Intensive Care at Home, we are currently operating all around Australia in all major capital cities, in all regional and rural areas. We are an NDIS TAC in Victoria, iCare New South Wales, NIISQ and DVA approved service provider. We are also offering level 2 and level 3 NDIS support coordination. We're sending critical care nurses into the home for predominantly long-term ventilation and tracheostomy, but other medical complexities as well. And I want to wrap this up here now. I want to thank you for joining. Thank you for your support. I'll do this YouTube live again next week, same time, 10:30 a.m. Sydney, Melbourne time on a Sunday, which is 8:30 p.m. on a Saturday evening, Eastern Standard Time in North America, 7:30 p.m. Central Time, Saturday evening in North America, 6:30 Mountain Time on a Saturday, and 5:30 p.m. Pacific Time on a Saturday. I'll see you there again next week. Have a good week, and thank you so much. Take care for now.